In terms of the recording that just came on, sorry, I wanted to give everyone more of a heads up about that. The recording is only going to be for the panelists, the panelist presentation. So we're not going to be recording during the community conversation, which I'll talk about in a bit. So we want to create a safer space for folks to share if they wanted to. So I don't want anyone to feel intimidated by that conversation, so we're not recording. But what I will say is we're really excited to have speakers Anna Willats and Lorraine Lamb with us today. We're going to have some time to ask our speakers questions. After that, go into discussion, and then we'll go into a little bit of a whiteboard activity to think about what it looks like to reimagine community safety and then next steps. Great, so we can move on to the next slide. So just some housekeeping things. We are accepting questions in the chat, and then if you do have a question during the panelist conversations, you can wait until the Q&A and put your virtual hand up. If you're not able to do that, and you're not able to type either, then you can just unmute and share. Just make sure you're not interrupting anyone. We also have a social worker here who's an active listener, Janelle. Janelle, do you want to say hi or wave? If at any point you feel uncomfortable or uneasy during our conversations, you can actually private message Janelle, and Janelle will set up a breakout room to have a one-on-one conversation with you. She's really there to listen and provide emotional or mental support and resources if that's what you also need. And yeah, just make sure to reach out to her if that's what you need during the session, and she'll go through some grounding principles to start us off in a mindful exercise. Hi, Janelle, go ahead.
Thank you so much, Saroja. So we'll start with the grounding principles. So once we get that slide, we'll go over that. But my name is Janelle, and I hope everyone's doing well. We are going to do a little bit of a grounding exercise just to have everyone arrive. But before that, I definitely wanted to go over some grounding principles just so that we can have a safe space and everyone feels comfortable sharing and receiving. So first, we want to make sure we're respecting for others' lived experiences and perspectives. We may all have different experiences related to safety. We want to make sure we're respecting for others' identities, including race, gender, sexuality, and abilities, etc. Be conscious of sharing space and time with others, allows others to speak who haven't had a chance. You want to make sure that you take a break if you need to. Of course, as Saroja mentioned, if at any point you want to have a conversation with me, I am going to be here, so you can send me a private message. I will be monitoring the chat as well, and I will carry you into a breakout room. And reach out to me again for that extra support. Okay, so really quickly, I wanted to go over a grounding exercise with you all, just because I think it's important to arrive. And when I say arrive, I don't mean physically arrive, because yes, we are here, but I do also understand that we all have busy lives, right? And I'm sure some people may be coming in from work, some people may be cooking, some people may be getting the kids ready. Whatever that might be, I want to make sure that we're all here, that we could retain the information, feel safe to share. And this is why we want to do this practice. So I want to invite everyone to just take a comfortable position, whether you're standing, whether you're sitting, hopefully not driving, but just get comfortable. And if you are comfortable, please close your eyes. And of course, if you're not, just soften your gaze. I want everyone to feel very comfortable throughout this practice, okay? So the first thing is I want us to just take a moment to center ourselves. In this moment, it is about you. Whatever happened 5 minutes ago, a minute ago, 30 seconds ago, doesn't matter. This is all about you. This is all about your experiences. This is all about your voice. Okay. So the first thing I want us to do is take a deep breath in and hold that. And then we're going to exhale. And what is one thing you want to release during this session? Okay. So I want you to envision that right now. What is one thing you want to release during this session? Maybe it's doubt. Maybe it's overwhelm. Maybe it's frustration. Maybe it's distraction. Whatever that might be, what would you let go of to create a space of clarity and focus so that you could receive and you could also share throughout the session today? Okay, so I'm going to give you a second to just think about what is that one thing you want to release so that you can be open to what we're about to all consume today. Now, think about one intention you want to set for yourself. Okay? It could be something like staying open to new ideas. It could be about giving yourself grace. It could be about finding one takeaway that moves you forward. Whatever that intention is, I want you to keep that at the forefront of your mind and keep it as a reminder. Let it serve as a reminder as we have these discussions, right? Because some of these discussions they may be triggering, they may bring up feelings, they may be empowering, they may be exciting for you. Whatever that is, keep that intention at the forefront of your mind. If it's easier, you can, of course, once you open your eyes, you can write down that intention on a paper so it's always with you so you can see it, okay? And I encourage you to hold it like a torch and remind yourself, no matter what happens throughout this session, your intention is yours. It is unique to you and it matters. Your voice matters, your opinions matter, your experiences matter. And we're all here to ensure that we are collecting as much information as possible for the end goal of what today's session is going to be. Okay. And of course, if you feel comfortable, you can drop your intention in the chat. And it's a simple way to just hold yourself accountable and inspire others. And if not, like I said, hold it like a torch. Or you can, of course, write it on a piece of paper so that you know what your intention is for the remainder of today's session. I will be here for the next 2 hours, give or take. So at any point, if you do want to reach out, again, you can send me a personal message. I will be managing the chat on the back end so I can see, and we can head into a breakout room whereas we can just kind of go over some things and just making sure you're okay. And I'm here to support. That's what I'm here to do. And I'm excited for the conversation. I do believe it's going to be very impactful. And I just want to thank our facilitators and our speakers for putting this together. And let's get it going. So I will give the floor back to you, Saroja. Thank you so much.
Thank you so much, Janelle, for grounding us. That was really powerful. And yeah, we're looking forward to your presence today. Thank you. So why are we here today? I think this is a really important question for us. How are we defining safety in this conversation, and what do we mean by alternatives? So I'm just going to take a few minutes to go through that. And I also want to thank Angela Coe, who couldn't be with us today with the Redesigning Safety Coalition, who supported us in planning this session. So safety is not universal. When we say safety for all, we want to include all communities. So that means also prioritizing communities who are over-policed. This includes Black, Indigenous, unhoused folks, people who use drugs, people facing gender-based violence, the LGBTQ2S plus community, and many more communities that we might overlook. So as we enter this new city budget season, we have been seeing continued increases to the police budget, regardless of all the amazing mobilizing that has been done in like many decades of work in Toronto by grassroots coalitions, despite the fact that crime rates are going down in Toronto. So community organizations and coalitions such as the Toronto Police Accountability Coalition and Redesigning Safety Coalition have presented strong analysis that shows there's a lot that police are doing, especially when it comes to responding to incidents that could be more effectively done by trained mental health professionals. And there's definitely more to that conversation. So this workshop is part of a series to think about how we can support and provide systems of care for over-policed communities without using force, violence, the justice system, or police. And we want to think about hopeful models that emphasize alternatives for folks who are in crisis. At the same time, we're mindful that many of us here are coming from different lived experiences and perspectives on policing and communities. So we really hope to create a space of openness and learning together, and want to welcome where everyone's at as well. So with that, what do we mean by alternatives? I know this word is kind of like floated around a lot, especially in the last couple years. So several grassroots groups and movements have been advocating for decades for community-led solutions to create safe communities that don't involve police. So this advocacy has led to the creation of successful programs and non-police responses to crisis, such as many of you are familiar with, I'm sure, the Toronto Community Crisis Service. It's a free, confidential service that offers support for people experiencing mental health crisis, and it's available citywide. It's delivered by community partners with crisis workers trained in mental health, and they come to your location during a crisis. They will also talk to you and understand what supports you need and respond to your mental health needs. So we do hope that, we want to host more in-depth conversations about alternatives, as well as do a deeper dive into the police budget in the new year. But this conversation is more of like a foundational one to just talk about what safety means for all of us and how we can include everyone in that vision. So we're really, really lucky to learn from our speakers today, Lorraine and Anna, who have been doing a lot of thinking around and organizing around community-led solutions to safety, especially when it comes to unhoused folks and women and gender diverse folks. It's now my pleasure to present our speakers. So Anna Willats, pronouns she, her, they, them, has been a Toronto-based social justice activist, organizer, and educator for 35 years. As a longtime member of the Toronto Police Accountability Coalition and the Groundswell Community Justice Trust Fund, she's committed to working collectively in a variety of ways for meaningful and progressive socioeconomic and political change from the ground up. Lorraine Lam, she, her, is a Chinese-Canadian settler immigrant with an education in music, sociology, and social worker. Driven by her commitment to Jesus's life and teachings, she has been a crisis outreach worker and case manager in the downtown east of Toronto for over 10 years, supporting people who are unhoused and precariously housed, and is currently a caseworker with Amadeus, supporting youth who are incarcerated for firearms charges. Her work focuses on housing and homelessness, systems navigation, advocacy, harm reduction, and trauma-informed approaches to collaboration, survival, and building a more equitable and just reality for all. Thank you both for sharing this space with us and your knowledge. I'm going to invite Anna to come up first, and then Lorraine, you can come up afterwards.
Thanks so much, Saroja. Can you hear me? That's okay. Hi, everybody. It's good to be with you virtually. And I know from the list of folks that are here that I get a chance to see a lot of you in 3 dimensions out there in the world. So it's really a privilege and an honor to be talking with you today. I want to thank Saroja, Janelle. That was such a lovely way to start. Thank you so much. And Mary and Ishrat and everybody involved with Social Planning Toronto and the other organizers of this event. And while I am a longtime member of Toronto Police Accountability Coalition and Groundswell, I'm actually mostly speaking to you tonight from my experience as a worker for 17 years, a counselor, public educator, and media person with the Toronto Rape Crisis Center for a very long time in the 80s and 90s up till 2000. And then since 2000, I've been a teacher at George Brown College in the Assaulted Women's and Children's Counselor Advocate Program. So all of these things are kind of contributing to what I'm going to talk with you about tonight. I'm coming at this conversation tonight to talk kind of about one of those issues that a lot of, certainly the media and a lot of us think or a lot of the public thinks that we really do need police and the legal system for, and that's gender-based violence. And by gender-based violence, I want to say, I mean, we're talking about sexual assault, we're talking about workplace harassment, sexual harassment, criminal harassment, interpersonal violence, like intimate partner violence, or what people call domestic violence, any kind of violence that's directed at feminine identified people, cisgender women, trans women, gender marginalized people, people who are perceived as feminine, and people who are marginalized because of their sexuality and their gender presentation. So, and gender-based violence is definitely experienced, you know, one-on-one in relationships and by people that we know. But gender-based violence is also systemic, and we only need to consider the long history of colonization and white supremacy and those impacts on missing and murdered Indigenous women, girls, and trans folks, and Two-Spirit people, and colonization, ongoing colonization, and other kinds of oppression, to understand the systemic nature. And gender-based violence is baked into our systems that we operate in, particularly the legal system. Our legal system here is based on a British model that sees women as the property of men, or initially, when it was developed, considered women to be the property of men. And while and that continues to this day. So that's the context that we're in. I started working at the Rape Crisis Center in 1982 as a volunteer and then as a staff person. And over the years, I became very aware in my working on a crisis line and working in community, became very aware that like 95% of the survivors and the people that I spoke to who had experienced sexual violence had no intention of or could not use policing or legal system of any kind, that the vast majority of survivors could not or would not use the legal system. And so early on, it became very clear to me that we needed to figure out alternatives to relying on that system for any kind of justice. And that's a big conversation about how you achieve justice when it comes to gender-based violence. But and so at the Rape Crisis Center, we developed a number of alternatives that really kept the focus on how the person who'd been affected, usually cisgender women that we were talking to, how that woman could take control of how she dealt with what had happened to her. And like I say, my experience was with women who had experienced rape and sexual assault, but this is also true in terms of intimate partner violence, sexual harassment on the job. And we worked with folks who had experienced all kinds of gender-based violence. And so some of those processes involved how could we go and confront the man that had, usually a man that had assaulted her. How could we as community put up posters if the assaults were happening in public? How could we put up posters and take action to defend each other and ourselves? So those kinds of alternatives have been developed for years and years and years. At the same time, we also pursued, you know, making sure to try to hold the police to account, highlight the things that they were doing. And we knew that, I think a lot of what I learned was not only was policing, were the police and the legal system not available to a lot of women, but they in fact caused more harm. And that was certainly my learning throughout the years, was that the legal system in fact caused harm to the people that were trying to use it. Often, for example, when the police took on the duty of mandatory charging, they would go into situations and they would end up charging both people because they had no kinds of analysis about the dynamics of gender-based violence. And so they assumed that both people, the husband and wife or the two partners, were equally responsible, especially if she had fought back in any way, or if he was claiming that she had fought back by hitting him or scratching him or something like that. So that we found that, I think one of the things I want to really emphasize is over the years, a lot of workers in our sector, in what we call the violence against women sector at that time, tried to come up with ways to reform the police, to make them better at responding to survivors. Zero tolerance for violence policies, mandatory charging policies, training, oh my goodness, training after training after training, and I participated in some of those. And what we found over and over and over again was that despite the best intentions of the people who were suggesting these reforms or these ideas, when they got into the hands of the legal system and the police, they got twisted and turned and used in racist, sexist, classist ways, leading to deportations, which is not necessarily what women wanted to see happen to their partners, for example, leading to dual charging, as I've mentioned, and on, leading to the child intervention systems getting involved in people's lives who did not realize that was going to happen, and leading invariably to years-long processes for the very few whose cases were believed that ended up actually leading to acquittals or other kinds of things where where the folks who had brought those complaints got no justice. Effective remedies have always come from survivors. It was survivors that started our shelters because there was no other place to go back in the 70s and earlier than that. We have always taken care of the survivors of gender-based violence in our communities. Setting up crisis lines, setting up systems of mutual aid, setting up ways that women could escape with their children underground and be able to be housed in these networks of safe houses that we were aware of. Little troops of, I remember lesbians getting together in little troops and patrolling the streets and making sure streets were safe for women and intervening. Lots of different ways, you know, small scale and large scale, not very organized and very organized, that we have come up with ways to keep each other safe. Communal housing, you know, unofficial kind of safe spaces for folks to escape with their kids. Also addressing the criminalization of women and trans folks and gender marginalized folks who are trying to survive on the street, in encampments, and I know Lorraine will talk lots more about that, doing sex work, doing any kind of work to be able to feed themselves and their families and keep themselves safe. And so fighting for decriminalization, fighting for the law and the police to get out of our lives, fighting for bylaw officers to get out of our lives, all the different ways that survivors of violence or women who are very vulnerable to violence have the legal system interfering in their lives. Today, in fact, is the International Day to End Violence Against Sex Workers. I just wanted to say on the December 17th. I guess there's lots to say, but I guess I just want to say that what survivors needed back when I started in this field in 1980 and what they need now is self-determination and autonomy, to be able to be supported to regain the control in their lives that has been taken away from them, to be able to not be dependent on an abuser, whether that's an abusive state or whether that's an abusive partner. The ability to live and be independent, which means affordable housing, accessible and affordable daycare that's available whenever it's needed, good paying jobs with adequate sick days and other benefits so that we can take care of our families, good jobs, healthcare, access to good healthcare that is gender affirming and understands the realities of trans people's lives and women's lives generally. Public transit that's accessible and available, public education, status, right? Permanent residency, access to citizenship. These are the things that women, trans folks, gender marginalized people need to be able to live lives free of gender-based violence and any kind of violence. And so we have to work for those kinds of systems, and we have to all talk together lots and lots more about how we can provide safety and autonomy to people who are vulnerable to gender-based violence. And I'll leave it there and look forward to a good conversation.
Thank you so much, Anna. Yeah, thank you for tying it all together with social determinants of health and really important pieces that we should be advocating for in the budget as well. Thank you. I'll pass it on to Lorraine now, and we'll have more time for question and answer after that.
Cool. Hi, everybody. Excited, glad to be here, honored to share this space with Anna. So I was asked to share a little bit about what safety looks like for people who are using substances, especially in the context of the closure of supervised consumption sites, and what are some alternatives to supporting people that don't involve the police. Yeah, so I guess, I mean, in my bio, like I'm wearing a hat today as somebody who has worked with people who are unhoused for the last 15 years. Some folks happen to be substance users. And then currently I also work with people who are incarcerated. So there is also some overlap there. I also feel the need to name that, like, when Saroja was reading my bio, there was a piece there about my faith, and I clearly copied and pasted that bio from a church space that I was speaking at. And so I realized that, like, sometimes people are weirded out by people who are like, they come from a Christian faith. And I promise I am not here to be like, imposing any like weird Christian-y things into this space. And you can say happy holidays to me and not Merry Christmas, and I'll be totally fine with that. I just felt like I needed to like put that out there. Anyways, so in terms of safety for drug users, I also want to just set the container here to say we're not here to discuss how we feel about drug use. I want to recognize that there's like a whole bunch of different opinions and feelings and perspectives that might be in this room. We're also not here to discuss what we think drug users should do, but we're here recognizing that there are people who are actively using substances. And so while that is a reality, what does it mean to create safety for people who are substance users? And I find the term safety gets tossed around a lot, and sometimes I'm like, are we talking about safety or are we talking about comfort? Like, what are we talking about here? And so I looked up how safety is defined. And according to Merriam-Webster, our dictionary friend, safety refers to, quote, the condition of being protected from danger, risk, or injury. And I thought that's a pretty good definition of safety that I can get behind. And when you look up the National Harm Reduction Coalition, which is an organization in the States, they talk about safety with like sort of three umbrellas. First being having safe supplies, second being informed, and the third being prepared. And I was like, oh, that's actually how like I look at harm reduction, which literally means what does it mean to reduce harm, like danger, risk, or injury to a person. And so recognizing that we live in a very politicized world right now around the conversation around harm reduction, I always also want to set the space to recognize that we have been practicing harm reduction in so many different ways over our lifetimes. So like if you ride a bicycle in Toronto and you wear a helmet, I really hope people wear helmets when biking in Toronto, especially if bike lanes are going to be closed. Right? Safe supply would be having a helmet. Being informed is knowing where you're going, maybe knowing where bike lanes are. Being prepared is like learning how to ride a bike properly, making sure your tires are inflated, right? So like helmets are harm reduction. Taking swimming lessons is harm reduction. Wearing appropriate layers in the winter, having designated drivers, lifeguards, education, like these are all ways that we actively practice harm reduction. And so specifically in the context of substance use, having safe supplies is a form of harm reduction. Having supervised consumption sites is a part of harm reduction, which is a part of this conversation about what it means to have safety, as in reducing danger, risk, or injury to a person. And so according to the National Harm Reduction Coalition, they then talk a lot about what it means to create safety in three different umbrellas. Specifically, one, why people might use substances, two, contextualizing substance use, and three, how do we make it safer depending on the situation? And in this conversation, I'm also specifically choosing to use the word substance as opposed to drugs because how we use our language shapes things, right? So if we're talking about why people use drugs, for instance, when you look up the definition of drugs, drugs are defined as any substance that alter our moods and something that creates a physiological effect. So literally, there are all sorts of drugs that already exist in our lives, right? But what we need to talk about in this conversation of safety is that there are certain substances that are deemed acceptable, certain substances that are glorified and almost even celebrated. Like, look at all of the alcohol commercials that we see around this time of year, right? And then we also need to name that there are certain classes of people who are more criminalized than other groups of people when they use certain substances. And when we talk about why people use substances, I mean, why do people smoke? Why do people drink? Why do people take Tylenol? Why do people use heroin? Right. And so I think that when people often have a conversation around, quote, safety and substance use, we're often just really focused on a certain class of people who are using a certain kind of substance. And my hope is that we can challenge some of those narratives and ask better questions around why. So when my partner doesn't have coffee in the morning, he's like, not the person I married. Just putting it out there, right? Like, but we all seem to be okay when we recognize that, oh, yeah, like a coffee withdrawal, that just happens. But why is it that we look at other forms of withdrawal differently? And ultimately, whatever substances people are choosing to use, everybody deserves to have access to life and safety. So that's kind of one thing that I always kind of want to consider when we talk about safety in the context of substance use. Um, And then the second arena we talk about is like contextualizing substance use. And so, as I mentioned before, people are using substances in all sorts of contexts for all sorts of reasons. Specifically in our landscape right now, the big dominant conversation is around the context of using downs, using street drugs, using fentanyl. And specifically, the context of drug use and substance use right now that a lot of us are thinking about in the context of safety is the unregulated street drugs, and we know that unregulated supply has been causing a skyrocketing number of overdose deaths. Um, and it's not just a certain community, it's actually overdose deaths are skyrocketing across a lot of different populations. And a couple years ago, a journalist in BC named Andrea Wu wrote a really powerful piece with like 50 portraits of people who have died from drug overdose. And in that piece, you could see that like the toxic drug supply doesn't discriminate, right? Like everybody is affected by it. However, it is a certain group of people who are discriminated against when they do use substances. And generally, those are people who are racialized and poor and often unhoused. And so, as we're talking about drug use context, we also know that there are some substance users who are unhoused, but there are also many who are housed. So, like, I'm sure many of us have heard of the stories about, like, college frat parties, right? Or whatever happens on Friday night on Peter Street. Lots of substance use is going on there, but yet everybody is often fixated around the safety and the concerns of perceived safety when we're talking about substance users who are living outside. And so I'm always also curious about that. Like, why is it that the people living in a tent are considered to be more dangerous substance users than the people who might be partying on Peter Street and then getting into their car after and driving back to Lord knows where? And so the other piece I also want to highlight around contextualizing substance use is also around the language that we use, as I mentioned earlier. I think language frames how we look at things. So when we talk about substances versus drugs, I think that also shifts the way we look at things. When we talk about people who are homeless versus people who are our neighbors, like I have some great neighbors and I have some shitty neighbors. They're all housed. So some of our neighbors happen to be unhoused. And I think our language around that shifts how we talk about people. I also I'm always curious about our very normalized language around the word encampments, which is actually a very militarized term. So, like, what if we refer to people living outside in tents? Not like what if we refer to those spaces not as encampments, but just as a neighborhood of tents? How does that change our framing of things? And how do we look at safety in that sense? And then there's also a lot of language around like addiction, which I kind of struggle with right now. And there's a lot of research out there around like addiction doctors and the entire business that it's become. But what if we talked about people who use substances as substance users versus addicts, right? Because do we talk about my partner's daily coffee drinking as an addiction? No, it's just so normalized, right? So I think there is definitely conversations around class and race and all of that stuff intertwined with our language. And then the third thing around safety, again, the National Harm Reduction Coalition talks about how do we make things safer depending on the situation. And I really appreciated that Anna said, like, essentially, people have been keeping each other safe forever. And people who use substances have been keeping each other safe for as long as I know. You know, in 2016 in Toronto, for folks who are around, like a lot of volunteers set up an unsanctioned overdose prevention tent in the middle of Moss Park. And that was a way at that time when we recognized, like, oh my gosh, like the drug supply was really toxic. A lot of people were dying. And like, what do we do? Well, let's figure out how we keep each other safe. So we actually, this tent was set up. People signed up to volunteer. People learned how to use oxygen, learned how to reverse overdoses. It was really powerful. And at one point, naloxone was actually not widely accessible in Canada, but like people started smuggling it from the States. And now here we are. It is widely distributed in pharmacies. Of course, there was quite a fight to make this happen. Lots of also, like if you just do a quick Google search, you'll find lots of like articles about that as well. And so again, to highlight that substance users have been figuring out how to keep each other safe forever. The question though is why they're not listened to or centered in the conversation, right? So another thing to make things safer, depending on the situation, we talked earlier about having safe supplies. So for instance, having needle exchange programs. Needle exchange programs have existed, again, it's about as a public health measure for decades, as a way to prevent HIV infection, even like, you know, not being infected by Hep C when you're getting tattoos, right? Those are all like safe supplies. So now we have like needle exchange for people who are drug users, having clean supplies for people. The other piece around safety is being informed. So like knowing what drugs, you know, may be more toxic right now than others. So like drug testing services are part of supervised consumption sites. But I also want to highlight that being informed is not actually just about substance users, but also like the wider community, including people who don't use substances. So like, for instance, I don't know if any of y'all saw this, but there was an article in City News today, which is completely bananas. But the the headline was police officer was like exposed to fentanyl and then he had to get Narcan. And I was like, hold on a second, what kind of misinformation are we spreading? You don't need Narcan if you've been like exposed to fentanyl, as in if it's right beside you, like you don't overdose by touching fentanyl, right? And so I think this kind of misinformation perpetuates a lot of really unhelpful myths around substances. And so when we talk about being informed, we need to be informing like the entire wider community of people who aren't substance users as well, to actually make sure people know the facts of what's happening. Another information or misinformation that's out there is that supervised consumption sites just like hand out drugs, which like, no, it doesn't happen. But if we did, it'd be a very different conversation, right? So I think being informed is part of how we make things safer. Also, if you hear slurping, that's my dog. I'm so sorry. He's a very passionate drinker. And then the third thing is about being prepared. So again, preparation is for people who are using substances, right? Like people knowing that they shouldn't use substances alone so that other people are witnessing what's happening. To reverse any overdoses should that happen. Being prepared is also knowing like, hey, you're not maybe not going to use your whole syringe at once, maybe like dosage yourself. But being prepared is also, again, for the wider community. Like, do we know how to respond to a potential overdose? Do we know how to recognize that an overdose might be happening? But again, like if we're talking about substances as drinking or any other kind of substances, do we know what to do if we're walking in the city, you know, on Christmas Eve and we see a young person who's like intoxicated and low and alone? Like, do we know what to do in those situations? So I think there's a conversation about what it means for the substance user to be prepared, but also for all of us. A few people in the chat at the start of tonight said, like, we keep each other safe, right? And so those are some questions that I have in terms of what it means to co-create safety. And that's why I was really drawn to tonight's conversation, because it's like, how do we do this together? And so specifically in the context of supervised consumption sites, that's why they're so vital in keeping substance users safe, because it's a place where there's safe supplies, where there's good, accurate information, and there's like preparation in terms of reversing overdoses and such. But a really big conversation that I often have with folks around this conversation around safety for drug users and substance users is ultimately this conversation comes back to like, whose lives do we value? Whose lives do we think are worth saving? Whose lives do we think matter in terms of safety? And I have a hard time with this conversation because sometimes it kind of pits like one group as more deserving of safety than the other, which I think is just really wrong and problematic, but that's actually like what we're working with here. And I was thinking about this tonight before this call, and I don't know if folks have been following the United Health CEO shooting in the States, but I guess the shooter, Luigi, um, was charged with terrorism today. His act of shooting was charged as an act of terrorism. But meanwhile, like we've seen mass shootings over the years, and none of those are considered acts of terrorism, right? And so when we talk about mass death and like the public health emergency that we're seeing around the overdose crisis, why are those lives that have died not valued the same way, but yet the death of a CEO seems to be like, like the CEO's life seems to be more valued than others? Whose lives do we value when we talk about safety? And so as we approach March with supervised consumption sites, specifically in Toronto closing, yeah, I'm really curious about what it means for all of us to co-create safety for people. Like, do folks on this call know how you respond to an overdose? Like, what do we do, right? And I think this is connected to this conversation around 911. And then a lot of people, like, we're trained from like Paw Patrol days that like we call 911 if we don't know what to do, right? Um, do we know what to do if we spot an overdose? Do we know what actually happens when we call 911? And part of the conversation today too is like, how do we avoid the police? And so a few thoughts that I have around here, like when you do spot a potential overdose, I always kind of say like you maybe don't actually know if it's an overdose, especially if you didn't actually witness the person using substances, right? If you just find somebody on the street and they look like they're not breathing, literally anything could have happened. And so when you are calling 911, it's actually really important to specifically ask for an ambulance. And the person on the dispatch will ask you, like, oh, what happened? And I always like encourage people to give as much detail with as much vagueness as possible, if that makes sense. If you didn't witness the person using substances, don't say, I think it's an overdose. You can simply say, I see this person and they're not breathing. And if they press you, you can just say they're not breathing, they're not responsive. And that's one way to actually try to deter the police from showing up. Sometimes the cops will show up no matter what, especially if you call from like certain addresses and intersections from the city. But there are ways that we can call 911 that don't encourage the cops to show up as much as possible. I'll also say that like certain people, as we've talked about, are over criminalized. So when we do call 911, oftentimes I've seen instances where we call to respond to an overdose, and then all of a sudden the person is like taken in the hospital and then like incarcerated because they had outstanding charges. Um, as somebody who works inside the jail space, I always want people to know like the jails are not the jails are overcrowded right now. There's a lot of violence. Like all of this is public information and documented. People are isolated. John Howard Society has a lot of research that shows that like people often lose their housing when they're incarcerated and then they're released into homelessness as well. So the current conversation around like throwing people in jail if they're unhoused or if they're substance users, fine them $10,000. Jails are also not the solution. And so I always want people to recognize that like when we call 911 for certain things, and we say it's an overdose, we actually increase the likelihood of the person becoming criminalized and incarcerated, and then all the things that happen after. And so I'll wrap up by saying that like I recognize there's also a tension sometimes in terms of like, hey, are we feeling unsafe or are we feeling uncomfortable? If you're riding the Dundas streetcar and someone is using substances on that streetcar, it is totally fair and reasonable to feel uncomfortable. And I want to say like it is not a bad thing to feel uncomfortable. And I think the decisions we make out of that discomfort is where we can like change this conversation. Is it unsafe? Like, yeah, I don't think we all want to be like smoking secondhand or inhaling secondhand smoke. So like, could we open the windows? Like, what are some ways we can navigate that? And so sometimes this is also a tension around like safety for one person versus safety for a whole group of people. And what does it look like for us as co-creators of safety to hold that tension well? And Anna said as she was speaking just now, she said effective remedies always come from survivors. And I think this also is very much true for people who are substance users. And I would be really curious if we could explore what creating safety looks like by including and centering people who are substance users themselves, and many of them are currently in the fight for keeping supervised consumption sites open and funding harm reduction resources and putting money and resources into social infrastructure rather than policing. So hopefully this conversation can move us into action to support some of those things that our communities who are substance users are fighting for. Thanks.